Hello, and thank you for coming to our briefing. We've been notified by state and local authorities and national authorities that there is a credible threat of a dirty bomb explosion in this area in the next 48 hours. They are working hard to prevent that, but asked us to brief you in case they didn't succeed in preventing it. Let's get into it. A dirty bomb is a radiological, or sometimes called a radiological dispersal device, is an explosive that has radiological materials within it. Detonation vaporizes but does not ignite those materials. They are instead propelled into the air and settle onto people and surfaces, including food, water, and soil, causing short and long-term damage. The biggest threat from the bomb is from the explosive itself. A dirty bomb is not a nuclear blast. We're going to see more damage to and injuries from the detonation. So, expected injuries include blast injuries, like injuries to the ear, lungs, brain, eyes, and belly, injuries from propelled debris, which are more dangerous to the patient due to contamination, blunt force trauma, and injuries related to fire, burn, particulate inhalation, and radiation exposure. Depending on the radiation source used, injuries can be minor to fatal. The size of the detonation is key in how much injury or death we might see. The worst case scenario is that a device is set off in a crowded area with a lot of structures nearby or other debris, other items that turn into flying debris. In terms of radiologic injury, the injury depends on three factors: how long the patient was exposed to the radiologic agent, the distance of the patient from that radiological source, and how much shielding was between the patient and the source. We can expect to see more intense injury from people who are closer. In terms of emergency care, we are going to treat the blast injuries first and radiation later. Authorities will be able to determine, hopefully, the radiological agent and distribute appropriate treatment if available. There are several kinds of radiation injuries that we're looking for. Acute radiation syndrome, or ARS, results from a high exposure to ionizing radiation in a short amount of time. Symptoms include onset, headache, nausea, vomiting, diarrhea, and can come on very quickly or within hours or days. Later stage illness can damage one or more organs, including bone marrow, heart, and nervous system. Cutaneous radiation syndrome is radiation burns on the patient's skin. Internal contamination results from the patient inhaling, ingesting, or absorbing radiation into their body. Patients can have a combination of one of these exposures, and extensive treatment guidance is available from CDC. Civilians in the area who are not immediately affected will be advised to get inside, and stay tuned for more information. They will also be instructed to remove external clothing and decontaminate themselves and their pets in a shower with soap, shampoo, and no conditioner. In terms of first responders, we would like you to take all precautions with yourselves, and that means that you'll be issued Tyvek suits to wear or hazmat suits. You want your best fitting mask, and you will be taking off those clothes immediately when you're leaving the scene. We are going to have muster stations set up that will also serve as decontamination stations, and we are going to work very hard to keep your time on scene at a minimum. The patients we're most concerned about are the elderly, the very young, people closest to the blast radius, and patients who are pregnant, particularly in early pregnancy, where the fetus may be very much damaged by that radiation. The good news about dirty bombs, the only good news that we have, is that they are considered weapons of mass distraction rather than weapons of mass destruction. As with any bomb, setting one off will cause a tremendous amount of injury and possibly death, but it's believed that the amount of radiation released would be minimum. Please keep your eyes open, look out for each other, take all the precautions possible. Your department will give you your assignments. Thank you for your attention.